And that's part of informed consent also, is we kind of look at the options that are available. We have a conversation about, if we can't get the thing that you wanted the most, what's the best option of the options provided to get as close as we can to where you want to be. A lot of times it's really not that different from the ideal birth, especially in a low-risk population like we're serving at the birth center. There aren't a whole lot of things that are happening that are needing to divert from the ideal birth plan that people have when they walk in. So sometimes it's just little tweaks, but it's all about informed consent as we're moving through the process of finding a way to the postpartum period.
Well, that can also be like the opposite of empowerful, especially when you have your mind set on something and it doesn't go the way you want it. A lot of people can feel distraught. So it's always about bringing them back to, you tried. Of course, we all have a plan for our lives or a plan for things how we want them to, but we can always be rest assured that we put our all into it, and even though it didn't go the way we wanted it to, there was still a beautiful outcome at the end. And that's what should be the main focus, especially.
It's really just a lot about talking, explaining like what the situation is, if we have to transfer care to a hospital, what that would look like, going with them if possible, giving them as much information possible. And in the event if it's a transfer of care during pregnancy, have that to be very seamless.
Well, first we counsel them before they even make their way into the birth center that there's always the possibility of things not going the way we would hope. We counsel patients that we don't wait till it becomes a last-minute emergency. We want them to understand that if we did have that, what is plan B? When do we have to make the move? And we notify our patients early on when things are changing and whether or not they can be corrected in that moment, or if they needed to be moved to a more acute care setting, such as the hospital. So we want patients to know before they make the choice that they don't have to worry about it being a 0 to 60 event. So patients are counseled along those lines. When the situation is happening, open communication is key. So we make sure that patients understand the status of what's happening in that moment, whether it be to them, to their baby and at that time, and make sure that they feel that they're confident in what's the next step. Do we stay? Do we go? But we're watching everything as we go along. So no one is being surprised with the next step. So that's how we try to counsel them accordingly.